Well, we're thinking pink on today's show, and joining me now is Dr. Collette with the breast surgery experts. Good morning, Avnu. Good morning. Good to see you.
Good to see you too. Good to see you.
Well, Breast Cancer Awareness Month is always a month that we can just think about breast cancer a little bit more and what it's all about, and maybe help raise some money for it too. For people who I think we all think we know what breast cancer is, but what is it actually, and what actually happens to the body?
Well, people think that cancer is some mysterious thing, and actually it's not much different than your cooking. A normal cell has a set of instructions, and those instructions tell the cell what to do, kind of like your recipe. And if you follow those instructions well, everything goes great. But sometimes the instructions get scrambled. You forget a spice, you forget the yeast, you forget something, and everything goes awry. Same thing with a normal cell. It can get the instructions scrambled, and then you end up with a cell that either invades or grows uncontrollably. And that's a cancer cell.
My mother-in-law just got done battling it this summer, and I'm happy to report that it actually went very well. Yeah. And she is definitely a survivor, and she's doing great, which is so hopeful. It used to be, it was like, when somebody heard that they got breast cancer, it was not good. But boy, things have really changed.
They have. It's an exciting time in breast cancer care, and most of my patients do very well and live a nice long life, and that's wonderful. We've made great strides in breast cancer care. And breast cancer, we're redefining it for a whole new generation. It is no longer a death sentence.
What are some of the causes, and is there anything that I can do and another woman out there to do to prevent it?
Yeah, those signals are scrambled for reasons. The number one reason is we just get old and our body scrambles signals on accident. But there are other things that can cause it. Having increased body weight, not exercising, not taking care of yourself. Alcohol can cause it. Too much hormone use, and that hormone is not just estrogen, but we now know that insulin and cortisol can be factors as well. So there are things that we can do to prevent it, but just knowing that there are things that cause it allows us to have the instructions to figure out how to treat it then, or how to prevent it.
Something on here, it says having babies before 30 can actually help prevent breast cancer. So is that true? And that's so hard for a lot of people who are working and putting their careers ahead. And
yeah, it's so interesting. So what we're saying is that from the time you have your first period to the time that you have your baby is the most influential time that our breast tissue has. That's where it's influenced the most. And so if you have a child early, that cycle's shorter and your breast sees less estrogen. So having a child early makes a difference, and that's such a cultural shift in our culture.
Right.
Actually, in the Midwest, we're a little bit better at it than the coast, but it's still a big deal. And that's something that actually we can do, but it's not always that easy. It's not always that easy.
Catching it early, and that's something that my mother-in-law did. Boy, that is huge.
It is huge. So what we know is early stage breast cancer today is pretty much curable. I mean, we can actually live a long life and manage the disease. It's a late stage. And so it really is important. If you want to be a superhero against breast cancer, the best thing you can do is get your mammogram, because we can find it before we feel it.
And when should women get those?
Yeah, baseline mammogram at 35.
Okay.
And I still recommend that patients get it yearly at age 40. Between age 40 and 50, it's difficult because the breasts are so busy that it can cause us to have false positives, things that we see that may not be real. For sure, yearly after age 50, but that 40 to 50-year-old range right now is the one that's causing all the controversy. But I still recommend yearly at 40 if you can.
All right.
Yeah.
I just got my reminder in the mail, so I'm on it. And then now seeing you, Dr. Collette with the breast surgery experts of NEW. A pleasure to see you again.
Nice to meet you too.
Thank you. Appreciate it.
Thank you.